Welcome to Wish I Had Known, the show where hindsight meets insight. Host Jodie Lamb has worn many hats in the world of finance, from navigating the intricacies of financial planning to unraveling the mysteries of insurance claims and diving deep into the realm of structured settlements. Each episode explores the topics that make you say, if only I had known this sooner. Join the conversation as we uncover the insights that can make all the difference. This is Wish I Had Known, because knowledge is power and hindsight is 20/20.
When knowledge is power and hindsight is 2020, we discuss one topic at a time to help regrets of saying, if only I had known. Today, we're talking with Dr. Eric Snowden, Executive Director of Carecrest Lifecare Planning and a chiropractor who's got a unique perspective and a story to share. Welcome, Eric.
Hi, thanks for having me. I love your show. I'm excited about it.
Well, I appreciate you. I thank you so much. I'm excited to hear what you have to share because you really do bring a unique perspective from your experience, both as a doctor and as someone who works with people who are evaluating injuries that have been sustained and ongoing future care, and a unique perspective to understanding the early mental struggles, the early, not only physical symptoms that we experience, but also mental challenges. So I'm excited to hear more about your story and what you have to share. But first, why don't you tell us a little bit more about who you are, and then we'll get started.
Sure. My name is Dr. Eric Snowden. I've been a chiropractor for more than 23 years. I specialize in occupational therapy and neurology, functional neurology. And through the years, I've done a lot of different things in healthcare. I've managed ambulatory surgical centers, specialty programs. I specialize in what's called ERISA, which governs all group healthcare plans. I've developed business models and software in which dentists can use our systems to be paid on the medical side of the house. So now you go to your dentist, you have a $50,000 procedure. Now we can get your insurance company, your medical insurance company, to pay for it. I've opened businesses that advocate for the patients. So you go to the ER and you're there for 2 hours and now you get a $20,000 bill. Well, we know that's not right. So my company will get that bill down to $1,500. What I love more than anything right now is what we call Lifecare planning. So in catastrophic injuries, burn victims, traumatic brain injuries, spinal cord injuries, amputations. These are people with future medical needs that are to the extreme. And so I'm contracted by attorneys to evaluate the patient's files, to assess future medical needs, including ancillary needs. Are they going to need adaptations to their housing, to their home? What future medical bills will they need? And I monetize it and I present a report to the court saying, here's everything they're going to need. And as it applies to what we're talking about today, more often than not, they're going to need future psychological counseling and what's called cognitive behavioral therapy. Now, what we found, and the studies vary from 18% to 40%, that people have post-traumatic stress after traumatic injuries or car accidents, even moderate car accidents. So that means in the first 3 to 30 minutes, we're going to be able to find signs of acute stress disorder in patients. And the way it happens is this. Whenever you have a new experience, your body has to absorb that experience and based on your previous experiences, understand how to perceive it. So somebody's in a car accident, that memory is stored in their brain, in their mind, all right, in the limbic system and in the long-term stores of their mind. And what will happen is the body will now adapt to that, right? So how do we know once we have a negative experience to be on guard against it? Well, our brain assigns a context to it. And when it does that, well, anytime that you have a like experience, your body wants to be ready. So what is it going to do? It's going to create what's called a stress response. So you're in a car accident, and I'll use myself. I was in a car accident. I was thrown out of a car. For the longest afterwards, every time I heard metal crashing, I would start to shake. Even in more minor accidents, you're going to find this. You're going to find increase in heart palpitation or heart rate. You're going to find constriction of blood vessels. You're going to have something that we call a stress response. So I wish I would have known then that every time I have a patient who presents after a car accident, that they should have a psychologic consultation. Because if we can address any type of acute stress within the first few days, we can keep it from progressing. And even if it hasn't been identified, it's still going to have long-term consequences. Decrease in immunity, increased risk of cardiovascular disease, decreased ability to deal with viruses and bacteria, and the overall anxiety, increase in norepinephrine or adrenaline. And more, if as many as 40% of people have signs of this, how many of us, the average American, is expected to be in 4 car accidents throughout their lives. And if you don't address it with the first, you're already predisposed when you have the second accident to having long-term consequences of stress and stress disorder from car accidents. So I wish I would have known earlier in practice, because one thing I did realize in practice is 90% of the patients I've seen over the last 23 years have long-term consequences of previous auto accidents. Now, here's where people don't correlate. That what happens to you, the long-term emotional distress can have long-term physical consequences. So, for example, somebody can be in a car accident, and whereas the average person may take 4 to 6 weeks for us to be able to contain and reduce inflammation consequential to the accident, somebody, based on their emotional response, and I've had this, will take 9 months for the same thing. Why? Because the stress response increases norepinephrine and cortisol levels, and it will actually keep pumping out inflammation. And there is a condition called respiratory distress syndrome, and reflexive sympathetic distress syndrome. And that's when you just can't contain it anymore. When even after the accident is long gone, your adrenaline is running so high that it starts causing decrease in blood perfusion to the extremities, long-term pain consequences, difficulty breathing, et cetera, et cetera. So I wish I would have known that if every patient were evaluated, that we could head that off.
Speaking from personal experiences, and I've hit my average lifetime expectancy of accidents so far, so I think I'm done. Knock on some wood later. Right. I've never once had this conversation with a physician before. I've never had this conversation with another professional before in this context. And so for someone like myself, like I wish we'd had those conversations. What is the how do I fix myself today? Because I can absolutely relate to the stress and the anxiety, especially when I'm driving. And my goodness, I have 15-year-old twins that are going to start driving soon. So I feel like that acute distress disorder or PTSD is going to potentially rear its ugly head in the very near future when they get behind the wheel. But what percentage of doctors are taking this into consideration immediately after accidents and making this recommendation? And for those of us that have not had that direction, what do our next steps look like?
Okay, for your first question, unfortunately, less than 5%. And I think that's being generous. I can think of 2 or 3 over the last 20 plus years off the top of my head. It's just not a consideration because they don't know how to monetize it. That's just reality. The good thing is this, is that every time you have an experience that your body stores memory electrically, right? An electric potential long-term in your mind. And whenever you get in a car, you see a car accident, anything that would trigger that, your body will take that new information into your brain, and it would meet with the memory you already have. The memory you already have either has a negative or positive context. And your body would go from there. And of course, from there, it would tell your body to release adrenaline, et cetera, et cetera. But also what happens is when you have a new memory, it also has to go into long-term storage. And in order to do this, the initial takes 24 to 48 hours. And during that time, you can totally recontextualize it. Even things that are in long-term memory We bring them to awareness. We analyze them. We recontextualize them. And then we make them concrete in the new context through bringing in the neocortex through writing and other things, and we put them into action. So it can definitely be done. And everybody's different. And I give a lot of credit to Dr. Carolyn Leaf, who developed the neurocycle to make it a very simple 5-step process. But it can definitely be done.
What is the success rate of the cognitive behavioral therapy?
It depends on what's going on. A lot of times, unfortunately, you generally see cognitive behavioral therapy with people who are traumatic brain injury. Then, of course, it's going to be consequential to how much damage has been done. And I can't think of any numbers off the top of my head, but let's put it this way. It's so much the standard. That is the standard in therapy. Think about anybody who goes in to get therapy. First thing you do is you bring it to awareness, right? You talk about it. And bringing it to awareness, you actually transfer that from your mind to your brain where it's vulnerable. Literally, when things come into awareness, they go through the amygdala, through the hippocampus, and they go to what's called the prefrontal cortex, where now you can change the context. So the first thing in therapy is you bring it into awareness. Then you look at, how does it make me feel? How does it do this? What am I feeling now? What are we doing? We're dismantling the negative connotation. And then you have to redirect it in a positive connotation, and you can't always do a positive, but you have to at least dismantle the negative so that you can break those neural pathways that causes adrenaline rush, the cortisol increase, and all those kind of things. So I know you asked me how successful is it? Extremely, to the point where it's the standard. The problem is people generally don't have access to it during physical accidents, unless it's a trauma. Somebody gets assaulted, then yeah, we know that's very traumatic. But unfortunately, we don't tend to see it when people have moderate trauma. And that could be a slip and fall. That can be a dog bite. That can be an auto accident. That can be seeing somebody else in an auto accident. And I mean, most of us can probably share stories where we've seen some pretty tragic accidents, like, oh, wow. Well, that affects us too. Any information that goes into us has to be stored in the brain, and the brain has to contextualize it, and it has to draw pathways in order to do that. So, and every time you have it, it builds on the next. So even if you've had them in the past, you have to go in and recontextualize those, bring them to awareness, recontextualize them, because that could be just the thing that brings you past threshold in the next accident, where now you really, really have some serious issues that you didn't need to have. And also you have to ask yourself now, how much of, all right, so the stress response causes inflammation. Inflammation is when your body is trying to get the immune components from the blood vessels out into the surrounding tissue and interstitial area. So it increases the diameter of the pores, opens the pores of the blood vessels, and allows the fluid part, the liquid part of the blood to pass out into the tissue area. That's what inflammation is. Long-term inflammation starts to tear down things, tissues. It'll start to cause arthritis. Arthritis, by definition, is inflammation of the joint. Anything with the word itis is inflammation. So when you have long-term inflammation, it starts tearing up the system. That's what autoimmune disease, it causes inflammation. If it's in the connective tissue, it's lupus. If it's in the protective coat around the nerves, it's multiple sclerosis. If it's at the joint capsules, it's rheumatoid arthritis. If it's at the joint itself, it's osteoarthritis. Even cancer starts with the inflammatory process. So long-term inflammation, whether you're aware of it or not, causes problems. How many times do you just even palpate or squeeze your own arm or leg and like, wow, why is that sore? I haven't been doing anything. Inflammation sensitizes the pain receptors. So inflammation makes areas more sensitive. And so when you poke or prod around your body or somebody else's, you're like, ow, why does that hurt? And you know you haven't been utilizing that muscle. That's generally going to be subcutaneous or under the skin inflammation. There's a young lady, a PhD, and she worked in Alzheimer's research. And I worked with her about 10 years ago to do study on Alzheimer's. And what we found is at its origin was inflammation that caused cellular swelling. The cells would burst. You'd have tau protein, amygdala, in the whole process. And what we find more and more, put it this way, in our nation right now, in the United States, when you look at the major reasons for disease and dysfunction, they all come back to inflammation. And it wasn't so 100 years ago. It was viruses and bacteria. But now everything starts with inflammation.
So if in the early stages after an accident happens and you're in this acute distress syndrome, did I say that right, state,
Yeah.
if cognitive behavioral therapy is implemented at that time, does that have the positive correlation of reducing that inflammation, reducing the symptoms, and potentially improving the recovery time?
And I would say it could. And the reason I say it that way, because for me to state it from A to Z like that, the first thing
there's a lot of things.
There's a lot of things in there. But yes, put this way, it would help, is my professional opinion, not only as a life care planner, as a chiropractor who's been doing this for a few decades now, that if more people who were in moderate and severe car accidents and other traumas were to get psychologic therapy, it'd be beneficial to them. And it would mitigate long-term both mental and physical consequences consequences.
I can say I wish I had known about this 30 years ago when I had my first really bad car accident. Actually, my first car accident. I feel like I have learned so much from you. If we want to learn more about this treatment, about this opportunity, even for attorneys or people who've been injured, what resources should they look into? Do they talk to their doctor about this? What are your recommendations?
Everybody's a little different. So I do have my website, carecrestlifeplanning.com. I'm also under Dr. Eric Snowden under LinkedIn. I can be contacted there. I kind of hesitate pointing people to one direction because, people have different backgrounds and everybody doesn't. You wouldn't go to an attorney if it weren't a personal injury or what we call medical legal type of thing. And I can tell you most PCPs won't be up to speed on it. But if anybody wants to know more, you can reach out, like I said, at Carecrest Lifecare or lifeplanning.com, CARECREST, lifeplanning.com, or find me on LinkedIn. You can find Carecrest Life Planning on LinkedIn, or you can find me at Dr. Eric Snowden, SNOWDEN, on LinkedIn, and I'll definitely respond, and I'll send you in the right direction. If there's something I can do to help you or my colleagues, that's fine. But otherwise, we'll make sure we'll send you down the right path. There's nothing worse than knowing you're not right and not knowing what to do about it.
That speaks right into this whole series where knowledge is power and hindsight is 2020. Any final thoughts or comments, Dr. Snowden?
Yeah, I'm excited because so much of the science and studies and technology are coming out that the things we talk about here are going to be just second nature, and we're going to have methods and ways to just change. You know me. I get excited about gene expression, about neuroplasticity. The body is incredibly resilient. And when we have knowledge, there's not many things we can't do. What you're going to find outside of the basic DNA, the majority of what you see in a person manifest is amenable. It's through gene expression, which can be turned on and off. And our neuroplasticity I've seen some incredible things in my years. I've literally seen somebody brought out of a coma. I've seen, I've helped so many people who are stroke patients who have had strokes 15 years before, and we stimulated neuroplasticity, and now we're able to bridge areas around areas that are dysfunctional. So, but my main thing is take care of your health. In the United States, and I love my country, we're probably ranked 40 plus in life expectancy. Our average life expectancy has just reduced to 77 years old. We have nations that are 81, 83, 80. There's no reason we should be behind everybody else. If we're eating right, we're exercising, and we're taking care of these type of things early, we should be able to have a full, healthy life like everyone else.
Absolutely. Our overall wellness is not limited just to our physical, but includes financial and our mental as well.
Oh, yeah.
Well, thank you again for joining. I really appreciate you taking the time to share this information. I truly wish I had known about this. I think I've had 30 years of, unaddressed issues from my multiple accidents. So I think I'm going to look into this a little bit more, and I appreciate you sharing this insight to myself and everybody else here. You've got an extraordinary story. Thank you for sharing. It's been another enlightening discussion here at Wish I Had Known, where we're expanding information and understandings for conversations where we wish we could say, wish I had known, or avoiding wish we had known conversations. If you've got a remarkable anecdote or story or wish I had known insight that you want to share, #AskJodie. I'd love to hear your story. If you come across a challenging situation and you find yourself unsure of what to do next, don't hesitate to reach out on LinkedIn. Send me a direct message, #AskJodie. Look forward to talking with you. Thank you so much for joining us today, Dr. Snowden.
Thanks for having me. It was a pleasure.
Thanks for listening to today's episode. Please like, share, and subscribe so you can hear all of Jodie's chats, so you don't have to say, wish I had known.